Foreground questions. Foreground questions are the heart of evidence-based physical therapist practice. These questions help clinicians and their patient clients make decisions about the specific physical therapy management of the problem or issue. Foreground questions contain 4 key elements. Number 1, relevant patient-client details such as age, gender, diagnosis, acuity, severity, and/or preferences. 2, a specific diagnostic test, clinical measure, predictive factor, intervention, clinical prediction rule, outcome or self-report outcomes measure. 3, a comparison test, measure, predictive factor, intervention, clinical prediction rule, outcome or self-report outcomes measure, and number 4, the consequence of interest for the diagnostic test, clinical measure, predictive factor, intervention, clinical prediction rule, outcome or self-report outcomes measure. The first and second components are included because a good foreground question has sufficient detail to search for answers that are specific to the patient client about whom the question is asked. The third component, a comparison, is in brackets because there may be times when a similar question is indicated or when a comparison simply is not available. Clinicians with more expertise in a particular content area may find it easier to ask comparative questions by virtue of their knowledge about a variety of options for diagnostic tests, clinical measures, predictive factors, interventions, clinical prediction rules, outcomes, and self-report outcome measures. Finally, the fourth component of a foreground question refers to what the therapist or patient client hopes to achieve during the management step about which the question is raised. Although questions about diagnostic tests, clinical measures, prognostic factors, interventions, clinical prediction rules, outcomes, and self-report outcomes measure have this basic structure in this common, they also have unique features that are important to recognize. The following sections outline detail about each type of questions. Table 3.2 provides examples of simple and comparative questions for each content area. Table 3.2. Foreground questions physical therapists might ask about diagnostic tests, clinical measures, prognostic factors, interventions, clinical prediction rules, outcomes, and self-report outcome measures. Diagnostic test foreground question. Sample. Simple. Will the nearest test help me to detect rotator cuff impingement in a 35-year-old male tennis player with shoulder pain? Foreground question. Comparative. Is the nearest test more accurate than the lift-off test for detecting rotator cuff impingement in a 35-year-old male tennis player with shoulder pain? Clinical measure. Clinical measure. Foreground questions. Simple. Is a manual muscle test a reliable and valid measure of quadriceps strength in a 42-year-old woman with multiple sclerosis? Foreground questions. Comparative. Is an MMT as reliable and valid as a handheld dynamometer for measuring quadriceps strength in a 42-year-old woman with multiple sclerosis? Prognostic factor. Foreground question. Simple. Is lower extremity muscle strength a predictor of fall risk in a 76-year-old woman with diabetes? Foreground questions comparative. Which is a more accurate predictor of fall risk? Lower extremity muscle strength or proprioception in a 76-year-old woman with diabetes? Foreground question. Which is a more accurate predictor of fall risk? Lower extremity muscle strength or proprioception in a 76-year-old woman with diabetes? Intervention. Foreground question simple. Is PNF an effective treatment technique for restoring core trunk stability in a 7-year-old child with right hemiparesis due to stroke? Foreground question comparative. Is PNF more effective than the NDT for restoring core trunk stability in a 7-year-old child with right hemiparesis due to stroke? Clinical prediction rule. Foreground question simple. Are the Ottawa ankle rules a valid clinical prediction rule for use with an 11-year-old child with ankle pain after a fall on icy surface? Foreground question comparative. Which is more valid clinical prediction rule for use with an 11-year-old child with ankle pain after a fall on an icy surface? The Ottawa ankle rules or the malleolar zone algorithm? Outcomes. Foreground question simple. Does participation in a cardiac rehabilitation program increase the chance that a 50-year-old woman will return to work following a myocardial infarction? Foreground question comparative. Does participation in a cardiac rehabilitation program increase the chance of returning to work more than a home walking program in a 50-year-old man following a myocardial infarction? Self-report outcomes measure. Foreground question simple. Will the Minnesota Living with Heart Failure Questionnaire MMLHFQ detect change following rehabilitation in an 82-year-old woman with congestive heart failure? Is the MLHFQ foreground question comparative? Is the MLHFQ more sensitive to change than the Chronic Heart Failure Questionnaire CHFQ following the rehabilitation in an 82-year-old woman with chronic congestive heart failure? Questions about diagnostic tests. Diagnosis is a process by which physical therapists label and classify a patient's client's problem or need. Tests used during the physical therapist examination provide the objective data for the diagnostic process. Foreground questions about diagnostic tests usually focus on which test will provide the most accurate and persuasive information. Example, the likelihood that the patient has the condition of interest in a timely manner with the least amount of risk, cost, or both. Questions about clinical measures. Clinical measures are distinct from diagnostic tests in that they are not used to detect the presence of or put a label on a suspected condition per se. Instead, they are used to quantify and or describe in a standardized fashion a patient's impairments in body functions and structures, as well as activity limitations and participation restrictions. Foreground questions about clinical measures usually focus on assessments of measurement reliability, measurement validity, and responsiveness. Questions about prognostic factors. Prognosis is the process by which therapists make predictions about the future health status of patients' clients. Foreground questions about prognostic factors arise because therapists and patients' clients want to know which pieces of information, collectively referred to as indicators, predictors, or factors, are most important to consider when predicting the outcomes of preventive activities, interventions, or inaction. Predictors often take the form of demographic information such as gender, race, ethnicity, income, education, and social support. Disorder-related information such as stage, severity, time, since onset, recurrence, and compliance with the treatment program, and the presence of comorbid conditions. Questions about interventions. Interventions are the techniques and procedures physical therapists use to produce a change in the patient-client. Foreground questions about interventions may focus on the benefits or risk of a treatment technique or both. The goal is to identify which treatment approach will provide the desired effect in a safe manner consistent with the patient-client's preferences and values. Additional objectives may include a desire to minimize costs and expedite the treatment process. Questions about clinical prediction rules. Clinical prediction rules are systematically derived in statistically tested combinations of clinical findings that provide meaningful predictions about an outcome of interest. An outcome of interest may be classification in a diagnostic category, calculation for prognostic estimate, or anticipation of a treatment response. Foreground questions about these algorithms focus on the accuracy of their predictions and the circumstances in which their performance is most useful. Questions about outcomes and self-report outcome measures. Outcomes are the end results of the patient-client management process. Questions about outcomes may focus on the type of endpoints possible in response to a particular treatment or on the methods by which the endpoint can be measured. Outcomes are likely to have the most relevance for a patient-client when they pertain to activities and participation as performed in the context of the individual's daily life. Of particular clinical interest is the usefulness of self-report instruments that measure outcomes from the patient-client's point of view. These tools usually focus on the impact of a disorder or condition on the individual's health-related quality of life. Foreground questions about these instruments focus on their ability to capture relevant information, their responsiveness to change in a patient-client status, and their ease of administration and processing.